been many great people to impact our society. Some have made great discoveries, others were great leaders. Some were founders, creating a pathway for future scholars to follow. One such founder is Florence Nightingale, the founder of modern nursing. I've been learning about Florence Nightingale in my nursing class, and I would like to share with you a little bit of the history about Florence Nightingale and her impact on the nursing profession. Born in 1820 in England, Nightingale was born into an upper-class family. At the age of 30, she entered nursing school at Kaiserswerth, Germany, although her parents didn't want her to. She remained there for about 3 years. Then during the Crimean War, Nightingale heard of the terrible conditions that the military officers were enduring in the local British hospitals. She took her new knowledge, her skills, and a few other women with her to a hospital in Scutari. Once there, she was able to provide good care for the wounded and sick soldiers, as well as work on the reform for the poor organization and hygiene that the hospital had. After the war, Nightingale established the first training school in London at St. Thomas's Hospital. She also wrote and published Notes on Nursing, What It Is and What It Is Not. This publication stated that in order to practice nursing, one must obtain unique knowledge specific to the nursing profession, which clarified that nursing was much more complex than people originally thought it was. In 1859, Nightingale herself stated in Notes on Nursing that beyond administering medicine, nursing ought to signify the proper use of fresh air, light, warmth, cleanliness, quiet, and the proper selection and administration of diet. Statements such as these began to clarify what the nursing profession was really about. Nightingale also stated in her work, Advice to Nursing Students in 1873, that nursing is most truly said to be a high calling, a noble calling. Nightingale also worked for hospital reforms for the British soldiers, stating that they needed to be improved drastically. Her philosophy was that a patient's health was significantly affected by his or her environment. Examples such as these are uninterrupted sleep, comfort, good use of sunshine, and many other factors. Cynthia Audane, a student researcher at Agnes Scott College, stated in 1998 in her biography about Florence Nightingale that Nightingale pushed for reform of the British military healthcare system, and with that, the profession of nursing began to gain the respect that it deserved. Nightingale also had great effect on the schools established in the United States because of the one that she'd already established in London. These schools would not be established until 1873. Nightingale lived to be 90 years old. She died on August 13th of 1920. She had an incredible impact on the nursing profession. She paved a way for the education to improve for years to come. She also pushed for the reform of the hospitals and gained the goals that she achieved for herself. Achieved the goals that she set for herself. Nightingale is a prime example of someone who perseveres and fights for what they believe in.